Recording in progress.
Bismillahirrohmanirrohim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah, the break has ended. Hopefully you ladies and gentlemen can rest well and get back in the mood for the next event, which is second panel session, which consists of 3 topics consisting trends and innovation in holistic health, culture, competencies in holistic interventions, and spiritual holistic in nursing. This session will be guided by our moderator, Mrs. Raini Purnamaraya, SKMM EPID. She is graduate from University College London of Epidemiology and Public Health on 2019. She is lecturer and researcher, and she has recent publication from 2021 to 2023. Okay, as you can see on the panel. So please welcome our moderator, Mrs. Raini Purnamaraya, SKMM EPID. Give a big round of applause.
Cek, cek. Oh, udah kelihatan tuh. Aman? Oke. Halo, Assalamualaikum warahmatullahi wabarakatuh. Rabbi srahli sadri wa yassirli amri wahlul 'uqdatam min lisani yafqahu qawli. Good afternoon, everyone. Hope you get a bit of a rest and then ready with your cup of tea or coffee for the next sessions of our webinar today. So we will first have um, the speaker from India, which is can you get me the CV or of the speaker? Yeah. So our first speaker will be Dr. Kirti Dang-Longani from Akemi Business School of India, and then she is graduated from a PhD in marketing management in 2014, and she has a lot of publication related with business and also holistic trends and innovation in holistic health. So is Mr. Kirti Dang-Longani already here in our Zoom?
Yes, I'm Rohani, yes, from Thailand.
Okay. Now I will give you 30 minutes to present your Yes. Sorry, I cannot hear you very well.
Yes, I am here.
Oh,
Rohani,
okay.
yes, from Prince of Songkhla University, Thailand. Can you hear me?
Oh, this is Kirti Dang.
Oh, no, I'm not Kirti Dang.
No,
Sorry.
so sorry, Prof.
Yeah. What time in Indonesia now?
It's 1 p.m.
Okay,
Yeah.
that's schedule. Yes.
Yeah, so you will be the third speaker, Prof. So we'll have Mrs. Kirti Dang-Longani from Akemi Business School.
Yeah,
Yes.
hello.
Yeah. So we have here Miss Kirti, are you okay?
Yeah,
Okay, thank you very much for coming. And then now I will give the time and place to you to present um your um talk on trends and innovation in holistic health. The
yeah.
time is yours.
Thank you very much. I'm audible?
Yeah, go ahead, Miss Kirti.
Yeah. So, good afternoon, namaste, and salamat siang to all estimated delegates, distinguished guests, fellow professionals, and all future health leaders. It is really an honor and a privilege to be the part of this international conference, which is on global synergy in integrative and holistic health, where minds come across. The global coverage with a shared purpose. Yes, it's to explore, enrich, and elevate the discourse on trends and innovation in holistic health. So, as a keynote speaker today, I really stand before you not just as a representative of a domain, but as a passionate believer in the power of integrative and holistic approaches that recognize the mind, body, and spirit as interconnected entities. We are living in the time of transformative change in healthcare. Traditional boundaries between system of medicine are dissolving, making way for interdisciplinary approach that blend modern science with ancient wisdom. Innovations in AI, genomics, plant-based therapies, digital health platforms, mindfulness techniques, and community based healings are a mere trends. They are reshaping the future of well being. So, today's discussion are more than an academic exercise. They are conversation that could define a new way in medical education, patient care, and public health policy. So, together, we can build a future where care is not just curative but preventive. It's very important to be preventive, where healing is not transactional but a transformational. So, this
Excuse
conference,
me,
I
Mr.
believe, is a
Christie.
platform for dialogue,
Eh,
for
Excuse me, Mr.
collaboration, and
Miss
collective
Kirti.
action. So, let's us share knowledge. I'm ready for the question conversation and spark innovation. So I'm really glad to be here in learning and sharing the truly holistic, human, and sustainable healthcare system along with you all. So thank you, organizing committee, to invite me as a part of this inspiring journey with you all during this conference. And all the sessions were really great. And I hope the whole conference will bring a drastic change in the holistic approach and thinking about how the prevention and cure is possible with interdisciplinary approach of medicine. I hope my screen is visible. Okay. So, we are going to talk about trends and innovation in holistic health practices. So, evolving field of holistic health, the latest trends and innovation in terms and treatment modalities, where the transformative role of technology and significance of community engagement in fostering comprehensive well-being and wellness. If we talk about trends and innovation in holistic health, we have to consider the whole human being. Yes, the whole person. When we talk about whole person, we focus on mind, body, and spirit. We emphasize on unity for wellness. We think about, as per the World Health Organization has defined health, a complete well-being. Yes, a complete well-being beyond diseases. So whether it is mental diseases, whether it is emotional, whether it is body. So rising popularity, we are going to discuss about how embarrass diverse treatment options. So lifestyle. Yes, we are also going to talk about the holistic approach in daily life because we had talked about prevention. Let's explore the trends in holistic health approach. So, integrating traditional practices with modern science. Yes, the traditional wisdom is very important. We are going to talk about mindfulness practice. So, this practice enhance mental health through integrated wellness. Plant-based diet, it's very important. So, awareness of health benefits from plant-based nutrition is growing nowadays. Personalized wellness, tailored health solution focus on tailored, that is customized, personalized. So we believe in personalized health solution nowadays that focuses on individual preferences and needs. Integrative approach, that is combining traditional healing methods with modern technology and modern science. Mainstream acceptance. So, holistic practice is very important and increasing. And yes, we have to accept it with the future trends. When we talk about transformative impact of technology, yeah, technology has been changed and it has also impacted health industry. It has also impacted health science as AI has been introduced in health. So telehealth services as access to care. Yes, so remotely we can have access with the telehealth services across the world. So patients connect with practitioners remotely, and that's really a very important, and it has become easy for patients to connect with practitioners anywhere in the world. Wearable health tech empowers active wellness. So there are a lot of devices and tracking metrics which is effectively be utilized and used, which is an innovation in the health industry. It also helps to make sure your holistic health and preventive care health app, which is important, which is facilitate daily wellness integration, which promotes mindfulness and nutritional practice. So whether it's about telemedicine, artificial intelligence, whether it's virtual reality, whether it's making use of data, big data in healthcare, all these things that really has transferred healthcare industry. So this is what we call as a digital transformation in healthcare. And that is how there is a reshaping of holistic wellness in 2025. Let's talk about innovative treatment. What are the innovative treatment modalities and holistic health? So let's explore new therapies that enhance, and let's also explore the traditional wisdom which has to be integrated with modern medicine, which enhance holistic health practices. So one which we had really discussed, plant-based medicines, herbal remedies. In India, we call as Ayurveda. Ayurveda is in traditional medicine in India, which makes sure that herbal remedies and supplements are being used in gaining popularity. And also the natural alternatives, which we call as naturopathy. That is, natural ingredients and natural alternatives are used for the well-being of health. When we talk about biofeedback techniques, yes, innovation methods which allow patients to understand physiological functions to enhance health via self-regulation. So there are a lot of apps which are being there which make sure and which keep you to understand the physiological functions to enhance health. Energy healing practices, there are different holistic practices like Reiki, acupressure, acupuncture. It's very popular in India, which are now part of the holistic treatment plans, which really facilitate healing process. There are a lot of alternative therapies. In India, we have Ayurveda, which is a traditional wisdom of Indian therapy. We have homeopathy, which has been originated for Germany 200 plus years ago by Dr. Samuel Hahnemann, which is again a alternative therapy, which is very much utilized in India and across the world. Then we have naturopathy, we have Unani, we have yoga, which makes sure the body and mind is being kept. So the alternative therapies is complementing traditional medicines and modern medicines to approaches to improve overall health. When we talk about holistic, we talk about mind, spirit, emotions, and body. Let's take us towards the navigating challenges. So, we have challenges in holistic health practices. So, let's understand the obstacles faced by holistic health practitioners in today's evolving landscape. The complex regulatory framework. Navigating the complex regulations surrounding alternative therapies can daunting from practitioners, impacting their practice and growth. There might be some legal obligations which are there, which are being implicated, can be a navigating challenge in holistic health practices. But many holistic practices still struggle for recognition. There are many health. Yoga is an Indian practice which is now being recognized, and 21st June is being celebrated as International Yoga Day across the world. But yoga has to struggle to reach that. Yet the popularity is not across the globe. We have a lot of scope that this yoga practices as well as Ayurveda has to be taken across the world. Same for homeopathy, which is a European or the German pathy, which also have limited scope in many parts of US and even in Europe, which is the cheapest, one of the cheapest medicines which are being available. So there are obstacles, there are struggles for mainstreaming this acceptance. So many holistic practitioners are facing this. So this has limited their reach and influence, which really make a difference in healthcare. So there is a need for comprehensiveness where we have to ensure the practitioner should make sure that patient is in center, patient is important, and cure. To make sure the cure of the patient, we have to consider a holistic treatment for them. Yes, there is an impact of community on holistic health practices. We can make sure that there are support groups which foster connections and understanding among individuals facing similar health challenges, creating a safe space for sharing experience. Community welfare programs are there in different countries, in different locations and regions. There are a lot of community healthcare and wellness program which has been implemented by might be a local bodies, government bodies, and there are NGOs which are taking place which support holistic health practices and community engagement. Shared knowledge. This platform is a beautiful shared knowledge platform where the different speakers had shared their approach towards the holistic health practices across the world. Such knowledge sharing can be a platform to build connections between different practitioners across the world for the well being of humanity. Integrating holistic practices in education is also important. I can see there are a lot of students, there are a lot of practitioners, and there are a lot of medical students who are the part of the conference. So let's integrate this holistic practice in education too, enhancing the students' well being. So, teaching mindfulness and stress management can improve overall student health, promote lifelong wellness, educating students about holistic approach, encourage healthy habits and early on. So, even from student life, every student should enhance, we should able to educate the students about holistic approach which encourages healthy habits early on. So because we are believing in prevention and prevention is always better than a cure, making sure the community engagement is much more stronger. Schools can partner with local holistic health practitioner for resources. Cultivate a culture of wellness, integrating wellness practices which helps to support your school environment. So, from a school to the institute, college, and universities, making sure that every child, every student, and every individual should be make enhanced for the mindfulness and stress management, for encouraging the holistic approach with encouraging healthy habits, making sure that well-being practices are practiced from the school environments, incorporating holistic curriculum, and engaging parents and families with it. And I think so, if we do that, it involves the well-being initiative and strengthens community ties. So if you have to think about healthcare practices and we are believing in holistic, it doesn't depend only on the patients who are coming to you. It's all about prevention, and prevention start at home. Then it starts with the community, family, schools, environment, corporate, and across the world. We have a lot of cases to be discussed about it, and I will going to take that at the end of this session. So, exploring future directions in holistic health research. Yes, research is very important, and investigating and evolving holistic health integration is an important part of it. So, more clinical studies will definitely support the effectiveness of holistic health, leading to wider involvement. Research in holistic practice means every medical practices, every supporting holistic practices should be taken care of, because every pathy has its own scope and own limitation. If we make sure the scopes are combined together or integrated together, and the increased research in this all therapies will definitely help for clinical studies and clinical approach. Now coming towards the technology, integrating of advanced technology, AI, and data analytics will play a crucial role in creating personalized wellness solutions, and that's important. So, AI as in health app, teleservices, and connecting practitioners across the world. Then coming towards the growing public awareness. As more people become aware about the holistic practices, the healthcare system will be more stronger. So let's take as a world, a globe, as a family, and approach them for awareness of healthcare practices and healthcare awareness. We have to combine and connect mind and body in a holistic health. Even the World Health Organization talk about a complete wellness of mind and body, not only the curing the symptomatic treatment. So let's understand the interplay between mental and physical health for better wellness outcome. There is definitely an impact of medical states. So mind body are connected. It's how our mind state influence our physical health. Stress management technique like yoga, medication always help, because they have effect on lowering cholesterol level. They have effect on lowering cortisol levels. They even influence the hormonal levels and improve the holistic health. So it has been practically proved that yoga and meditation helps to calm your mind and ultimately affect your body to make the prevention as well as cure of the symptoms. Emotional. So it's not only about the mind and body, but it also coming towards the emotion. Human being is, or human body is an emotional. So emotional well-being is also very important. Maintaining positive mental health is crucial, and it correlates with reduced rate of chronic diseases, highlighting the role of psychologically holistic health. So when we are integrating treatment plans, we have to think about mind, body, and emotions because they are interconnected. So healthcare providers can develop more effective treatment plans which address both body and mind, If we make sure the mind symptoms or the mental health of the patient or the emotional connect of the patients are being taken care of, it definitely have an effect on improvement of the physical symptoms. So many of diseases are related to mind. Holistic health approach also incorporate practices that address both mind and body, which have an enhanced overall health. There are different treatments which are available, which are taking care of body and mind, and that are natural remedies for health. So many people are turning towards natural remedies, like turmeric is an excellent anti-inflammatory properties. There are a lot of herbs, there are a lot of home remedies which are practiced in different parts of the world. I had heard about the herbal therapies which are being practiced in China. I had also seen and experienced the medicines, herbal medicines and plant-based medicines which are used in Thailand. Same in India. India is rich in a heritage of Ayurveda and natural remedies, especially home remedies are being used in every home in India, which has an effect on holistic health practices. These are called as our ancient wisdoms, which has been utilized. And ultimately, we are making sure with an environmental sustainability. If we are making the holistic approach with natural remedies and Ayurveda in our treatment. So, environmental sustainability. We talk about sustainability in every area. Same is applicable in medical field too. So, the rise of plant-based therapies reflects a
Excuse
growing
me, Miss
sustainability.
Kirti. The
Yes.
time is 5 more minutes.
Okay.
Thank
So,
you.
it's had an effect on a growing sustainability in healthcare. Integrated health models which enhance wellness. Let's look towards, and you can see the symbols over here. So it's an integrating health models. It is a total health approach, functional medical medicine explanation, growing popularity of holistic health, patient-centric approach again is an important part. So when we talk about education, and we are here from education field where the medical practitioners are there and medical students are there, I emphasize on a role of importance of education in holistic treatment. So there should be a regular workshops and seminars, regular training sessions, online courses, best clinical and client care, updated knowledges and update knowledge and sharing across the globe, like this conference is making sure. So, evaluating the effectiveness of holistic practices, it's very important. The role of inpatient, the role of healthcare sector, the role of community, the role of families as well, of course, and overall the role of practitioners and medical students who are looking towards the future of holistic health practices. So, education on health choices, encouraging self care, enhanced patient engagement, physical activity promotion, nutritional guidance, educating on healthy eating practices, building support network, making sure your daily lifestyle is being improved. There are few key trends and innovation, personalized wellness and practices. And here you can see, I had already shared with the organizers my presentation that there are few cases which you can read about how nature-centric healing and eco-wellness has growth, how the functional food and gut health supplements have increased the health of the patient, how biohacking, longevity and medication. Here I told about medical vacation. Yes, medical tourism or medical vacation is also very important. So luxury retreats um, has been one of the focus. That is wellness tourism, focusing on brain health, neurofeedback is also one of the wellness therapy. Ethical Ayurvedic herbs, vegan products, eco-friendly lab-grown crystals. You can talk about nutrition and health. We can talk about stress management, sleep, a best medicine to make sure your inflammation and recovery happens rapidly. Homeopathic Tibetan treatment, digital Reiki, electromagnetic therapies, ancient therapies which are being worked with tech enabled vibrational wellness therapies, Chinese herbs, and so much of music. Music therapy combining art, music, nature, breath work, and mindfulness that also can combine together for the best healing. Detox, yes, detox is important. Forest bathing, eco wellness, nature centric healing, supplements. These all are different therapies which can be utilized, which can be combined together to make sure. So, and I just want to tell about join in transforming health education and practices. And today we are at that platform. Let's encourage all the educators, all the medical practitioners, all the medical students to adopt holistic health strategies. We should not stick on only one therapy or a modern medicine, but yes, when it's required, we have to incorporate these practices for the better healthcare framework. We can enhance our understanding of health. We can promote wellness for the mind, body, and spirit, and overall communities. We had seen this in COVID. We had faced COVID, and here we found that these all things matters a lot. Thank you very much for the patience hearing, and I'm open for the question answer forum.
Yeah. Thank you very much, Miss Kirti, for a very interesting talk. If I can conclude, your presentation is about or focuses on trends and innovation in holistic health practices in 2025. It emphasizes integrative approaches, combining traditional methods with technology, such as telehealth, wearable tech, biofeedback, plant-based medicine. Similar with here in Indonesia, we have also turmeric. I think also in Malaysia and Thailand. So it's
Oh,
yeah, one of our similarities is the growing use of turmeric. Yeah, for our health, and also energy healing. So this talk also highlight growing acceptance of holistic methods in mainstream healthcare, the importance of personalized wellness and community engagement for promoting overall well-being, and also the challenges such as regulatory complexity and mainstream integration are acknowledged, alongside opportunities in education, research, and advocacy for advancing holistic health. Yeah, it's very interesting. Now, we have 10 minutes to uh, question and answer. Let's see. There is one in the chat. I can see that. And then maybe one from the chat first. Yeah, I will wait. Oh yeah, or somebody from the Zoom who raised hand. Yeah. Um. Okay, this is from the chat. Um. I cannot get the name, but this is the questions. The question is, what are the current trends and innovation in holistic health practices that can be integrated into nursing care to promote patient-centered and comprehensive care? Would you like to ask, would you like to answer the question one by one, or do you want us to collectively gather
one
the
by one.
questions?
One by one,
Oh, okay. So
I
this
can
is the
answer
first
this.
question. Did you get
Yeah.
the question or should I read it again?
No, no, no. I can see in the chat box. I can answer.
Ah,
Thank
okay.
you.
Go ahead.
So when you talk about the current trends and innovation in holistic health, and I think so the question is that how we can integrate in nursing care in hospitals. Yes, we can definitely. When a patient is been admitted in a hospital, I will just give one example of it. I have one in my city. There is one hospital called as Pune Hospital, and which we are looking towards the cardiac patients. When they look towards the cardiac patient, they are not only giving treatment within modern medicine, but now The cardiac problems are mostly also through the lifestyle disorders. So, making sure that the practitioners and wellness staff in this hospital have making sure that when the patient is admitted or the patient visit them, they will look towards not only the treatment with medicine, but also making sure how the nursing care of these patients can be taken, which will promote patient centric. So they take a detailed case of the patient, look towards their lifestyle, make and suggest changes in their lifestyle. They incorporate in them yoga practices. They incorporate in them a few traditional and ancient medicines. They make sure their lifestyle is being changed. They also make sure their diet, that is nutrition, is being changed, because that is again one of the factor which affect the cardiac related diseases. So in that way, this hospital is making sure while the patient is being admitted, that how the holistic approach can be taken care, where not only the modern medicines but also different therapies, whether it's a diet therapy, whether it's yoga, whether it's meditation, whether it's lifestyle changes, or any alternative medicine which can help patient to recover more faster and its life span can be increased.
Kadang-kadang muksin dok. Apa sih ceritanya? Oh, orang India. Iya, dok.
Okay.
Bukan.
Thank you very much for the answer. It's the question from Fikri. Yeah,
Okay.
Fikri. So the sorry for the nuisance. So there should be compilation of modern medicine and also changing of lifestyle and also some traditional medicine that incorporated into a holistic healthcare, which can be enhance the speed of recovery for the patient. Is it? So
Yes,
hopefully, yeah.
definitely,
Okay.
definitely.
Next, we have another question, or we can ask one of the viewers, Aura Jannati. Are you there, Aura Jannati? Would you like to
Yeah.
open your mic and then ask the speaker?
Okay. Thank you for the opportunity, Miss Reina. My name is Aura, a nursing student from Universitas Aisyiyah Bandung, and I would like to ask, how can nurses leverage technology and digital health innovations to enhance holistic health practices and improve patient outcomes in various healthcare settings? Thank you.
Okay, Miss Christy, did you get
Yes.
the questions?
Yes, I heard the question.
Okay.
She has been asking of the how the innovation and the technology has to be implemented in the medical care or healthcare practices. Yes, when we talk about holistic health and combining different therapies or practices together for the holistic health, we can add a innovation in digital platform or innovation and AI in medical healthcare to enhance the treatment. For example, which we had seen about the digital apps, which is being utilized to monitor the parameters of the patient, which will definitely help them to realize and self control their lifestyle, their nutrition, their health. So there are so many digital apps, and I think so across the world. In India, there are digital watches which are being used to monitor the healthcare, how many steps or how many calories they have burned, for making sure the diseases which are specially related to the lifestyle and the chronic diseases which are related to the diet and the lifestyle can be prevented, can be monitored, and can be self monitored by the patients. And I think so when we have a combination of holistic practices with the implementation of technology and digital apps, it will definitely improve.
Yeah. Okay, Aura. It's about digital apps combined with other traditional things. Yeah, in holistic care, and we also have plenty of digital apps nowadays, not only from the big brands, but also the small and local brands, which is very affordable for us. As
Yes, yes.
yes, the local brand is very cheap.
Very cheap.
So
The
it
local
is
brands are really
really,
very cheap, and that can be utilized by the common man too.
yes, that's true. Okay, we have plenty of questions from the chat, and then I haven't seen any raised hand yet. Let me continue with the second question from the chat. It is from UTM, Aminat Rinzi. Thank you very much for the question. So, that was eye-opening to various other alternatives used in different cultures. I have noticed similarity, but in the base of difference, as I am from Maldives, we also feel the peace and harmony when we go to the beach. So this could be a beach therapy, I guess. So I think that is not questions. Yeah, I think it is sharing from Aminat UITM, but lives in Maldives. Very nice, yeah. And
Yes,
then
yes.
she also saying something about sometimes we ask mothers to go to take a swim after giving birth. It's a therapy too. It's the
Yes.
Maldives. I think it's very easy to
Yes,
send
yes,
baby to the
absolutely.
beach.
Thank you for this. Is a beautiful question. That yes, there are therapies which are definitely affected by our so nature. Nature is a natural therapy.
Yes.
Nature, whether it's beaches, whether it's mountain, whether it's forest, it affects our body and mind.
Yeah.
So well said by him that in Maldives for the peace and harmony, the beach therapy is in being used in India too, and many parts of the world. The nature itself. So when we are stressed out, when we are not feeling well, when we are emotionally disturbed or mentally not sound, nature therapy is the best therapy. So whether it's for the beach therapy, and just now, ma'am, you told about a swim after a delivery of a baby. It's also a one of the therapy which is used in few countries. So relaxing your mind away from everyone, sound, peace, in harmony with nature, with the sounds of birds, with the natural colors of trees and flowers, with mountains, with wind, breeze, water, or beaches are the best therapy which has been used and been proved to have cured and prevented many diseases.
Yeah, that's true. And for us who sit a lot in the office, we can have microgreen therapy. So we have
Yes,
small plants
absolutely.
and then just go to
Absolutely.
the little plants for once in a while. Actually, this is the question from Aminat. The question is how innovation and technology works easily with digital immigrant patient and digital native patient. It's from Asma, sorry. From Asma Saif, Malaysia, not from Aminat.
Okay. It means the patients who are not your local, and when we are
Immigrant.
in touch with the patients across the globe, right?
Yes, yeah.
Okay. So, yes, definitely, it has been that innovation and technology really works great when the patient is not with you, and there are teleservices or telemedicine, or might be there are so many apps which we are using for practicing, where the therapies or the treatment are given on telephone, or might be with Zoom, or might be few apps which has been used where the digital native patients, even immigrant patients, are being treated. So definitely it works, and the future is there with such innovation and technology for healthcare.
Yes, the world is nothing nowadays, isn't it? Because the geographical things can be really cut because we have technology and digital technology. And then this is another question from Yosa, one of our student here in UNISA. So he asks about how can students start practicing holistic health in their daily lives.
Now, combining the pathies might be difficult as per the legal regulation of each country. Suppose I am an homeopath. So I'm an homeopath, whether I can combine Ayurveda or the modern medicine or the Unani medicine, it's all depend upon the legal aspect and the government authorities which rule in that particular country. Few therapies are not permitted, like few therapies are not being practiced in few countries and not been permitted. But when we talk about few such medicines, for example, I'm a homeopath and I'm practicing homeopathy. I can utilize natural remedies. I can use home medicines. I can practice meditation. I can practice um tourism or tour or well-being or nature as a therapy. I can ask my patient to go across in the beach and relax, have a peaceful mind, make sure I can suggest him a diet, a nutrition diet which is required as per his acute or chronic diseases. I can make sure him to practice meditation or practice yoga, which is permitted to me. So yes, in few cases, we can use different holistic health therapies together. But yes, we cannot combine such practices together. Like if I am an homeopath, I cannot practice allopathy or Ayurveda, where I have to take help of few other practitioners to make sure my patient get the benefit of.
Yeah. Okay. Thank you. What about the students, Miss? How can a student practicing holistic health in for themselves? I mean, do they
Apa?
need to learn more about yoga or Ayurveda? Yoga is
Yes.
the very global uh
Uh, I think so. In
sports
Indonesia,
nowadays.
also many people know about it, right?
Yeah, that's true.
And natural medicines or home remedies are the best one, which we can combine in any practices.
Yeah.
Then nature wellness and
Yeah.
nature wellness,
Mm-hmm.
like we talked about just now, the beach therapy or the
Yeah.
forest therapy, that can be combined.
Yes, that's true. Yeah. Okay. Thank you very much. I hope it answered all the questions, and then thank you again for very interesting talk. And now we go to our next um activities, which is giving certificate to you as the speaker from our organization here, UNISA Bandung. It will be given by Vice Dean of Faculty of Health Sciences, which is Mrs. Angriana. The time is yours, Mrs. Angriana.
Okay, thank you, Miss Ray. Thank you so much. We are honored to present this certificate to Dr. Kirti Dang-Longani for your valuable contribution as a speaker at this webinar. Thanks for sharing your expertise with us, Dr. Kirti. Thank you so much.
Thank you. Give a very big applause for Mrs. Kirti. Thank you very much. Hope to see you again soon. Bye.
Thank you.
Thank you. And we'll continue to the next speaker, which is um Associate Professor Zamzaliza Abdul Mulud, PhD, which is from Universiti Teknologi Mara, Malaysia. And you will have also 30 minutes of a talk, but let me give you a bit of Mrs. How should I call you? Zamzaliza vitae, curriculum vitae. So wait she graduated from Royal College of Surgeon in Ireland. Oh my god, it's very far away from Malaysia. Same with here. And then also a PhD in nursing from also Ireland, and a master degree in gerontological nursing in Australia. And spent her nursing program in University of Malaysia, Sarawak, and then prior to that having a diploma in nursing in University Science Malaysia. and then working as an associate professor in the Center for Nursing Studies, Faculty of Health Sciences, Universiti Teknologi Mara, and also a program coordinator in Master in Nursing Critical Care and Master in Nursing Women Health Center for Nursing Studies, Universiti Teknologi Mara. So if you ever want to study about nursing critical care or women health, you can go also to Universiti Teknologi Mara, yeah. And then lots of publication by index by Scopus or Web of Science. The last is on experiences of parents in providing care and support for their children with cancer while striving for resilience in East Kalimantan, a qualitative study, the Malaysian Journal of Nursing, 2025. I think that's a very impressive vitae of Miss Zamzaliza. And for the topic, you will be explaining about cultural competencies in holistic intervention. The time is yours. Is Miss Samzaliza here already?
Yes, yes.
Yes.
I'm sure.
Sorry, yeah.
Okay.
Thank you very much for coming. Alhamdulillah. The time and floor is yours.
Okay, thank you so much for the Madam Chairperson for your kind introduction. So, can you hear my voice clearly? Everybody
Yes, we
can hear my
can.
voice?
Yes,
Yes.
yes, we can.
Okay, okay, okay. Thank you. So, I'm going to share, or the secretariat will share the slide for me, or
Yes, we can, ma'am.
okay. So I'll just wait for
Yeah.
the.
Just say next whenever you want to go
Okay.
to the next slide.
Okay, so okay, the slide is here. So I'm going to start the talks and the sharing session with all of you. Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon to everyone. So first of all, I can see that there's more than 400 participants in today's webinar. There's a lot of people from, I think, all over, not only limited to Indonesia, but we can see that some of you from UITM as well. Yeah. So, thank you for being here today. It is a pleasure to share this session with all of my colleagues who are committed in delivering the meaningful patient-centered care. So, as the Madam Chairperson have introduced to all of you, I'm the Associate Professor Dr. Zamzaliza from Universiti Teknologi Mara, Malaysia. So the title of my sharing session today is I will talk about cultural competence in holistic interventions. Yeah. So next, please. Okay, so now we start with the basics. Yeah? When we talk about culture, it is actually we refers to the deeply embedded pattern of human behavior. What we are, how we react, our behavior, the way we think, it actually shapes by our culture. Yeah. So these patterns can be very widely across different groups. So for example, Indonesian and Malaysian, even though people always call that we are looks like a siblings, but actually, in terms of culture, even though there's a similarity, there's also some differences between Indonesians and Malaysians. So in healthcare setting, however, this is a very important aspect because of when patient admitted to the ward, they bring their own cultural backgrounds, unconsciously or consciously. So it's indirectly influence on how they view the illness. So how they'll describe the symptom and what kind of treatment they are comfortable with. Yeah. So we need to understand all of these factors. So for example, when a woman admitted to the hospital, sometimes they rely on their husband, their spouse, or if they're single, they rely on their parents to make the decision on their behalf. So as a nurses, or as a healthcare providers, we need to understand. So culture competent is just not about respectful or polite. It's about having the skills and awareness to interact effectively with people from different backgrounds. Even though, for example, we are Malaysians, even though Malaysians admitted to the hospital, but sometimes they have their own cultural practices, depend on where they live and how they were raised up, in their children and so on, their family members. Okay, so throughout this presentation, I will discuss or I will share with you about the culture influences in healthcare practices, especially in holistic interventions. So we also will look at the practical examples, relevant models, and evidence-based strategies that we can apply and by nurses and healthcare professionals, how we can use these strategies to improve the nursing care. So next, please. Okay. Okay, so as we continue, we looked at some concrete ways on cultures influence how people understand health and healings. And these differences shows up every day in our clinical practice, even though we are not aware about that. However, how we react, how nurses, how we react on that, sometimes will influence the quality of care that we provided to the patient. For example, belief about illness. So first, let's consider the belief about illness. Not every culture sees illness purely as biological, physiological changes. Some patients may believe the illness is caused by supernatural causes, like being cursed, the karma from past actions. So, and then for us Muslim, sometimes patient may view it as a test from God, ujian daripada Tuhan, or spiritual imbalance that needs to be corrected. And so it's not rely on the medicines only. It's also required the involvement of God's and spirituality. Okay, and then it will influence on how they will deal with their illness. For example, some may go to the traditional healers or spiritual leader first before coming to a clinic or hospital. For example, those with mental illness, they're hearing voices and so on. They see something that actually not there. So they believe it is caused by black magic, for example. So instead of going to the hospital, they ended up looking for the dukun. If in Indonesia, maybe they call it dukun or bomoh in Malaysians. So, and then culture also shapes the health seeking behaviors. So, for example, in some cultures, going to the doctors early is seen as a wise and proactive. So, for example, those who are in Western countries, if they have any symptom, they will straight away go to the doctors. Okay, in some population, in some culture, the patient might avoid it unless the symptoms more severe. Because they want to treat it first. They want to treat it using the traditional method first. Then they'll come to the hospitals. And then in the help-seeking behavior as well, family also influence, have their influence because of some individual, they make the decision independently, while in other culture, the family, even the community has a strong say. They need to ask the husband first, ask the parent first before they can go and get the treatment. Okay, next, communications. Different cultures communicate differently. So because of if Western countries, there are more direct. If you ask patient, they will answer directly. But sometimes in our Asian population, we are quite timid. When people ask us question, sometimes we are reluctant to answer. We just apa orang kata angguk Angguk, not nodding our heads to answer, to indicate yes. Okay, so next is the importance of culture in holistic care. As a healthcare providers, especially nursing, we know that treating patient is never about managing symptom only, or giving medication. Holistic means we aim to treat the people as a whole. A whole meaning that it involves body, mind, and also their spirits. So, and then the whole patient is actually shaped by their cultures. Okay, and then next is we also need to understand if we call holistic care, there's no one size doesn't fit all. So meaning that the ways you treat the patient, we cannot use it to all patients, because each patient, they have their own needs. So a work that went well for an individual might be completely inappropriate or offensive to others. So you need to be careful. So not to what we call in Malaysia we call sama rata lah. We treat people similar, doesn't regardless their their cultural backgrounds. Okay, so for example, in pain expressions, some cultures encourage people to express their pain openly. Other expect it to be hindered, endured quietly as a sign of strength and dignity. So different culture, because of sometimes we see that because in Malaysia we have three major ethnic group. So different ethnic group, they express the pain differently. Some ethnic groups they will crying, they will screaming to display their pain. But for other ethnic group, they will just keep quiet and endure it. Okay, and then next. Okay, so how we can apply culture competence in holistic interventions? So first is physical care. Even something as routine as planning for diet, we need to mindful of cultural food practices and taboo. So for example, some patient may avoid certain foods or for religious reason. For example, as Muslim, we will avoid porks or non-halal items. So others maybe prefer traditional remedies or herbal treatment that might ask whether they can use them alongside prescribed medication. So you need to be careful because sometimes the traditional remedial, it has what we call effects with the medications. Okay, next is psychosocial care. Cultural influences how people relate with each others, especially within families. In some cultures, family involved is expected in every step of care. In others, individual autonomy is emphasized. Because, for example, in our population, Southeast Asia commonly will involve family in decision making. So, and then we also need to be sensitive to the gender roles, because of some patients, they may not be comfortable discussing personal issues with providers of opposite genders or receiving treatments. For example, in labor rooms, when delivering their babies, they are not comfortable when the attending doctors is male doctors. So you need to understand that. Okay, next is spiritual care. for many people, healing is just not about the bodies, it's also about the soul. So culture competence means able to respectfully and support the patient's spiritual needs. Whether the patient needs to pray, they need to apply the specific routine or use the traditional practices. Okay, so as a nurse, that's not our roles or duty for us to believe of these practices. So, but that's our job to respect it. And please respect whatever they're the one that practice. Okay, next. Okay, so this is how culture, this is a few examples that I can share with you on how culture can influence treatment and care decision. I'm sure that if you're a student, you are used to went to the hospital and then you used to treat patient from different cultural backgrounds. For example, Muslim patient, mostly they avoid the medication that containing alcohol or animal gelatins. So patient may reject certain capsule unless alternative are available. For example, there's blood thinning injections that contains the pox substance there. And sometimes we need to really explain to the patient about the use of that medication. Okay, next. Okay, next, please. Okay, so and then about the communication style, for example, the Japanese or Thai patient, their indirect communication to avoid confrontation. They may not or say yes even they don't understand the instructions. Because of sometimes when we use different language, so they only nods. So we cannot consider it as agreed. So you need to use the teach back methods, meaning you ask them to repeat whatever instruction that you gave them. And then another one is Middle East families. So for Middle East families, there are family-centered decision making, where male family members may speak for female patients. So in this case,
Excuse me,
providers should still
Prof.
involve
10 more
patient.
minutes.
Uh-huh. Come
10
again?
more minutes.
Oh, okay, okay. Okay. So, okay, next. Okay, Japanese and style. Okay, we just move to different this one. Okay, we have covered the gender and modesty concern about the women's the religions so how their uh treatment impact on these populations. Okay, so next. Okay, so next, I just move to the because these only the examples. Uh, I'm sure that if you used to work in the hospital, you will see this kind of patients. Okay, next. Okay, so I just maybe if you interested in doing some research, in doing some intervention related to culture competence, you can adapt and use this model of cultural competence. Kopinha Bakuti 2002 model of cultural competence. It consists of cultural awareness, cultural knowledge, desires, skills, and what we call counters. So you can use this to improve the training, for example, for patient, for nurses about the cultural competence. Next. Okay, next framework is the Parnell model for culture competence. So this also another framework that you can use. It has 12 cultural domain that guide us to understand how we can be competent in cultural backgrounds. So next. Okay, I think this is the most familiar models or theories related to transcultural nursing, where it is called Leninger's theory of cultural nursing care and transcultural nursing. So it was developed by Dr. Madeline Leninger, and then it has developed a sunrise As you can see, the model looks like a sunrise. Yeah. So this model can be used for us to understand what are the components, what are the variables that influence the cultural competence, cultural belief. Okay, next. Okay, so this is another one. If you're interested in reading about the concept analysis, so this is the concept analysis for cultural competence. It has antecedents, attributes, and consequences. Okay, next. Okay, so what are the evidence-based implication of cultural in clinical practice? So far, we have looked about why culture competence is matters and how we can apply it. So first, we need to know that when we have culture competent practices, it will improve clinical outcomes. Okay, so because of a study by Garcia in 2016, showed that culturally tailored diabetes education program has led to significantly better HbA1c among Hispanic and African American patients because they embedded the cultural components to address the issues of diabetes. So nurse, we also see this when we work with patient, when during the diet planning. So we need to understand the cultural food practices. For example, the fasting, the practice of fasting, food taboos, and sometimes after delivery, they cannot take certain type of food because it considered can cause bloated and so on. Okay, next. Okay, so another evidence-based implication is the reduction in health disparities. So health disparities is avoidable gaps in health status or access of care. So different population, different group, sometimes it has the gaps. Some people, they want to go to the hospital to get the treatment, but some people, because they know that even though they needs the treatment, but because of their cultural belief, they don't want to go to the hospital. So it will create a gaps in the health in one country. So in other words, if we want to reduce the disparities, we have to move beyond the clinical treatment alone. So we need to understand and include patient views of how they view the illness and disease. Okay, next. Okay, so next, it also enhance the patient providers communications. So when we take in cultures into account, we just don't speak to the patient. We want to connect with them. We want to create trust. And we want patient to trust us so that whatever education that we give to them, they will accept it. And then they will apply it. They will change their lifestyle based on our education. But first, you need to gain their trust, and you need to build the rapport. And because a study by Kovacs found that patients perceive their providers as culturally sensitive, they will report high level of trust, engagement, and treatment adherence. So it can be said that this wasn't about the language. It's not, we are talking the same language, but it's about feeling respected and understood. Yeah. Okay, next. Okay, fewer adverse event and medications error. And because of the a review by Al-Shamari in 2020 found that lack of cultural training contributed to communication breakdown and clinical errors. So it can cause medication error or any medical errors. And because of when we talk, they understand differently. Or we assume that the patient understand because they keep nodding their heads, for example. But actually they don't understand, and then they're non-compliant to the medications. So in the end, it's not about the communication issues actually. It is about the safety issues. Okay, next. Okay, improve patient satisfaction and engagement. Of course, if you give patients treatment, we want the patient to satisfy with our care, with our management. So a study by Saha showed that a clear link between cultural concordance, where patient and provider shares and understand each other's cultural background, and higher level of patient satisfaction.
Excuse me,
Okay,
Prof. 2
so
more minutes.
okay. Thank you for the reminder. Okay, next. Next, please. Okay, so another consequences of cultural incompetent care in terms of patient and system outcome, it can cause misdiagnosis and miscommunications. For example, in some cultures, avoiding eye contact or staying quiet in front of authority is a sign of respect. Especially we are in the Southeast Asia population. Sometimes people, we cannot say they're shy, but because of our culture, we just smile when people talk to us, when people explain some things. So maybe the doctors will assume that we understand the teachings, but it's actually how we behave, our cultures. Okay, next, reduce patient treatment adherence, because they don't understand, so they did not adhere to the medications. For example, a Muslim patient refused to use gelatin-based capsule or injection that contain the pork, because if there's no other halal alternative, that will result in the skip dose. They didn't take the medication at all. Okay, next. Okay, so this one I think I already covered it. Health inequalities. Next. Okay, so how we can integrate the cultural competence into holistic assessment. Of course, you need to gather the information. So you need to ask question. Ask question about what they preferred. So you don't need to use any checklist, but you need to communicate. Try to understand the patient, what their views about the illness, what they can eat, what they cannot eat, and why. So and then another one is to identify the cultural needs. So explore the patient culture influence and their expectation of care. So do they have any specific preferences for gender of the caregivers? So because of for example in Malaysia, in a ward, and sometimes the male caregivers, they cannot take care of their female relative, even for his wife, because we respect other female patients. We don't want any male patient overnight in the same wards. So that's the culture. Okay, and then respecting their belief, even though we don't agree with the patient, because they said that they want to take, don't want to take this medication, they don't want to take this certain type of foods, they don't want to take eggs after operation, or they want to take chicken, any meat product, because they don't want the wound, unhealed wound, even though we know that protein is very important for wound healing. So we need to respect that. And maybe what we can do is to provide alternative. Don't just disagree with them, but try to provide the alternative. Okay, next. Okay, training and education. Of course, we need to do the workshop, the training to our healthcare professional, for nurses, on how to respect, on how to learn about different cultures. Okay, so you also can do the culture awareness program, culture awareness weeks, that we can learn from each other's cultures. And then provide interpreter service. So sometimes we have a communications barrier, especially in Malaysia. We have many foreigners that work here. Sometimes it can cause miscommunication. So here we will have the interpreter to help the communication between nurses or doctors with patient. Okay, and then incorporate culture practices. Okay, so next, how about the education? How can we integrate culture competence in education? Next slide, please. Okay, so integrate the culture competent into the core curriculums. So I'm sure that many universities, when you reside in Indonesia, you will have the exchange program. Or you have a mobility programs outside Indonesia. You came to Malaysia and came to UITM. So I think that's a very good practices that you can learn. Not only learn about the nursing care, nursing management, but also learn about the culture differences. Using experiential and reflective learning, you can bring the patient, the student to the village with different culture background to learn about that. Okay, next. Okay, cultural assessment and communication skill. And we can use many frameworks. Learn framework, ethnic frameworks. Kalman's question. Kalman question is actually X question that we can use when we first met the patient to understand the cultural preferences. Only 8 question, very simple question, but it will give you ideas on how we can understand patients' cultural backgrounds. Okay, and then you need to train the educators. Okay, next. Okay, implement routine cultural assessment in patients' care. So you need to understand, is there any preferences or restriction of diet that you need to know? Is there any preferred genders that they prefer the nurses to be male or female and so on? Okay, and then we also need to promote interprofessional collaboration with cultural experts. For example, about imams, about the chaplains, if their patients is because we need to understand the culture, the religious background in order for us to give the best nursing care to the patient. Okay, next, this is our last slide, final recommendation. Strengthen the policies for inclusive and ethnic care. So you need to align your framework or policies with maybe ICN Code of Ethics and WHO Global Competency Standard, as well as our own national nursing boards on how they view the cultural competence. Okay, next is the ongoing cultural trainings. So that's the one that I already mentioned. Do the workshop, short course, go overseas, go to different cultural population, just to understand different culture. Meaning that you need to go outside and looks at the what we call different views and different world. Not only limited to our own populations. Okay, I think that's all from me.
Yeah, thank
Thank you
you.
so much for listening.
Yeah, thank you very much, Prof. Zamzaliza, for insightful presentation highlighting the essential role of cultural competence in holistic healthcare. We've learned how deeply culture shapes patients' health beliefs, communication patterns, and treatment choices. Um, we also know that the emphasis of culturally competent care can enhance patient-provider communication, improve clinical outcomes, and reduce health disparities. We also know from the talk that um, there's some recommendation for integrating cultural training into nursing education and practice. And as we know that there is a saying in English, when in Rome, do as the Romans do. So we need to learn about the culture to understand better of the people that we taking care of or our clients. or in Malay or in Indonesian we can say di mana bumi dipijak di situ langit dijunjung. I think it's the same
Yeah.
with the Malaysian, yeah.
Yeah, same to me.
So thank you very much, Prof, for the very insightful talk. There are some questions already from the chat. One of them is from Ibu Poppy, one of our colleagues here in UNISA. Let me read the questions for you. Thank you. Your material is very informative. May I ask, what is the appropriate culturally sensitive communication model for communicating with patient or families about death or end of life condition, especially in Eastern cultures such as Indonesia and Malaysia?
Okay, thank you so much for the question. That's a very good question. So about the end of life, actually, there's a dilemma among the nurses because sometimes we are feel uncomfortable to talk about death and dying. Is it correct? I think it is similar in our culture, Southeast Asian country, because sometimes we cannot communicate. We don't know how to communicate about dying, is it? Because it looks like we did not giving them any hope, any hope. But sometimes you can use communication that there's some in my slide in I think in page 26 about the ethnic models. Actually, the ethnic model, explanation, treatment, healers, negotiates, intervention, collaborate, and spirituality. It is actually developed for elderly. It's developed by for elderly. So it can be used when we want to communicate, especially those who are in palliative care. So because of it's quite tricky when we want to communicate for those in palliative care. So we want to give them comfort, but we don't want to give them a false hope. Is it correct? Right. We don't want to give them a false hope because if they're palliative, we know that the chance for them to heal is very, very minimal. Very, very what we call we not call it there's no hope, but it's not a very high hope. So maybe you can look into that further and then try to communicate, try to understand what they need and so on. Because of I understand that our culture is quite difficult to talk about death and dying because we feel that we are not comfortable with our own feelings. But we need to understand that dying, death, and dying, they are all a natural occurrence. Everybody's will go to that, this one. So, but I think to make sure that we really prepare for that, then maybe we can conduct a trainings. We can conduct workshops on how to handle patients in palliative care. So I hope that it answers your question. So I think that's a very good question.
Yeah, thank you very much. It's very clear.
Yeah.
Um, there another question from Agus Poltekes Malang. It's thank you. Good topic as a lecturer. How for preparation to be a good role as a nurse to make good communication with patient based on your experience. How to prepare before practice in the hospital for nursing student. Thank you.
Okay, thank you. So I assume Pak Agus Pak Agus maybe a lecturer So how can we prepare the students before they entered their maybe clinical practice? So I think the first one you need to have the topics or contents in your curriculum. It is good if you can put it in your first year content before they goes to for their clinical practice about the transcultural nursing, transcultural nursing on how different people and how their own belief. Because of, for example, for myself, I'm a Malay. I will be familiar with Malay culture. But when they go to the hospital, they will encounter with Chinese patient, Indian patient, even patient from Indonesians, from immigrants from other countries, from the Aboriginal patients. So they need to really understand. You really need to prepare them before we go to the patient. Or another thing that we can do is to do the outside, what we call sometimes patient or students involved in summer camp. And they will go to different Aboriginals village and to understand the way of living and so on. But I think this process is not what we call limited to the classroom teaching. And we need to really expose them to real life. Even that when we expose them in the clinical practice, they will learn during their clinical practice. So as a lecturers, it is our role for us to guide them and to guide them to make them comfortable when treating the patient from different backgrounds. Okay. Okay, I hope that's answer your questions, Pak Abdul.
Yeah, so yeah, it needs to be comprehensively what is it given to the student, isn't it, Prof? Starting from the theory and then also the practice and small practice before going exactly to the clinics. Yeah, and then we have more questions. However, because our limited time, I will give you another questions from the chat from Sirin. So thank you, Prof. I would like to ask, how do we accommodate traditional healing practices or spiritual beliefs in our care plan? For example, for rural areas. That's the question. Do I need to repeat the question?
Okay, about the traditional healings,
Yes, it's
healing
about
techniques.
yeah, traditional
Okay,
healing
so thank you
practices
so much
into
for the
the
question.
care plan.
Okay, so about the spiritual belief, for example, in rural areas, and sometimes it's quite difficult. So I think the first thing that you need to do is to gain their trust. Actually, gain their trust, even though what they believe is contradicted with what you believe. You need to put your belief aside first. Try to understand from their own point of view. So you, even though they say, I don't want to take chicken because it can cause the wound is not healed. So you cannot say that directly, but you need to understand. Okay, if you don't want to eat chicken, what else that you can eat? So you need to gain their trust and build the rapport first and build the trust, and then it will be easier for them to comply with your educations. So even in Malaysia, actually we have certain hospitals that have the complementary medicines units. They offered the what we call acupuncture, the massage, and all the traditional methods of healings. Because they don't want to separate about the modern medicine with traditional medicine. They try to integrate. They try to find the middle ways on how we can respect the practices, and then how we can also without we ignore the modern medicine. But I think we need to first build the rapport and gain their trust. Of course, we cannot bring all the bomoh and dokun in the hospitals. But I think along the ways, we will reach the middle ways between the traditional and modern medicines. Okay, is there any other question?
Yeah, there are plenty of questions, Prof. But however, we are limited of time. Sorry, do I sound clear to you? Is my voice clear enough?
Yes.
Yes. Okay.
Obviously,
Um.
it's not clear, your voice.
Yeah. Sorry for the inconvenience. So because of our limited time, we need to collect all of the question and probably will send you by email, so you can,
Okay,
yeah,
sure.
or people who really wants to ask question to Prof Zamzaliza, please please drop an email to her, and then maybe communication will start from there. And now we will go to, thank you very much again, Miss Zamzaliza, and then we are going to give you a certificate for becoming one of the speakers in this webinar. It will be given by Miss Maudi, which is our organizing, the chief or of our organizing committee of this webinar. Miss Maudi.
Okay, good afternoon, Dr. Zamzaliza. Can you hear me?
Okay, clear, very clear.
Okay, thank you. Okay, this is the certificate. This present to you. Thank you, Dr. Zamzaliza, for being a speaker and sharing the knowledge with us. Thank you very much.
Thank you for the invitation as well.
Yeah, thank you very much. Hope we see you again very soon in the next webinar. Thank you.
Okay.
Assalamualaikum.
Waalaikumsalam.
Okay. Without further ado, because the a limited time, we'll go to the next speaker, which is Associate Professor Rohani, Dr. Rohani Zahera. I don't know whether, sorry for the pronunciation of your name. Is Dr. Rohani already here?
Yes, I'm here.
Yeah, okay. Let me share a little bit of your CV. Yeah. So Dr. Rohani graduated from Prince Songkhla University for her PhD in epidemiology, and then a master degree from nursing science in mental health and psychiatric nursing, Faculty of Nursing of Prince Songkhla University, and also a bachelor degree in nursing, first class honor, and then has been working in the Faculty of Nursing in Prince of Songkhla University as a lecturer, and also experience as a registered nurse in the ICU of Unit Songkhla Narind Hospital. And then the project is quite a lot, and gain a lot of research grants, and then also produce a lot of publication, which is the latest is in 2024 on a model of uptake of national immunization program among children. Yeah, thank you very much for coming, Dr. Rohani. And then you are going to talk about spiritual holistic in nursing. Hopefully the audience is still very present and mindful in this webinar, because this is a very last talk for today. Are you ready, Dr. Rohani? And then
Yes,
we're very
I'm
sorry with the
ready.
condition
Yes.
in your country nowadays, but thank you very much to give your time to our meeting today. Yeah, the time and the floor is yours.
Okay, thank you very much, and good afternoon, everyone. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much for invitation. Invite me to join this conference or this webinar. Today, the topic that we will discuss is about the spiritual holistic nursing in 30 minutes, right? In the next
Yes, in
30
30
minutes. Yes, in the next 30 minutes, maybe I will show you some example approaches in nursing practice that my colleague, and some of the evidence in Thailand, what we have done about the spiritual health, holistic health nursing in Thailand and in the deep south of Thailand. Yes. When we talk about the spiritualities, spirituality is not only for the religions, but it's beyond than religions, but it is the like hope and meaning of life. So in spiritual holistic nursing, we can define that a nursing practice that the nurses recognize the interconnectedness of the person's physical, emotional, mental, and spiritual well-being, that aim to provide the care to address as a whole persons, right? For spiritualities, it means that how the nurses that can enhance the patient or our client's growth mindset to achieve the quality of life of them, even in the wellness condition or in the illness status. There are so many the concepts of the spiritual nursing, but this slide I show you the some concept of the Bangola. They present about the spiritual nursing theories, right? When we want to provide the care for our clients, I saw that clients, but not the patient, because some of our patients they may not be ill, so we call the clients, right? In the concept of Bankola, however, they focus on the patient. It means that the spiritual care in the illness condition, right? What to do, what the nurse should be do to provide the spiritual care. So these theories or this concept explain that when we take care some patient or some clients, so all the patients need the spiritual care. So we call the spiritual needs of the patient. In caring of spiritual needs or of the patient, so the nurse should be have the like a competency that we call the spiritual competencies. And when we are going to provide the spiritual nursing care, it's not only for the patient, but it should be considered the family as well. And we have to look at the cultural background of the families, not only of the patient. There's the very important competency that can enhance the spiritual care of the nurse is the how nurses can build the trust to the patient and provide the care concurrently with the cultural backgrounds, as well as the nurse should be sensitive for the spiritual needs of the patient or of the clients. This model is mean that nurse should perform the interconnected between patient, family, and their competency to provide the core of spiritual care. Another theories that explain about the spiritual nursing care. This is the theory we call the trust theory of the bars from the bars model, right? Trust theory explain that if we have to take care the patient, some patients, so we have to assess the needs of the spiritual needs, right? So from the trust model, it's derived from the alphabet, right? T, it's from the traditions. So the nurse should explore, are there anything would the patient should know about the spiritual or religious practice or belief, right? So the nurse should assess this condition. It means that assess the patient or family traditions, reconciliation issue that the nurse can support and provide support to the patient or their family. The nurse should understand a particular personal belief and helping them to sustain comfort at the time of the illness, and to search to search the oriented questions about the current challenge that the patient have faced nowadays, what they need. This is like a searching, and teachers, the last one is teacher. So the nurse should understand that there are people or group or resource from the patient side to find them in like a increase the spiritual or increase the need or the hope in coping with the illness. There are so many theories that explain, but this is like a I show you some the model that we can apply easily in the spiritual nursing care. What are the key aspects of spiritual nursing care? So when we aware or we concern on the spiritual care, so the first thing that the nurse should recognize the spiritual dimension of the patient from each different of cultural background. So we have to understand ourselves that what the spiritual dimension of the patient that we have to taken care. For Muslim, what are the spiritual dimension for Buddhist or for another ethnic group? So we have to search this spiritual and make us ourselves to understand the spiritual dimension. The nurse should assess the spiritual need by using the instrument or the tool that effective to assess the real needs of the patient. There are so many instruments that we can use. So this is we can apply with the concurrent with the our cultural background as well. When you use the need assessment tool, so you have to select that which one is appropriate to our unit or our practical setting. So there are so many instruments that you can use. In the spiritual care, so the nurse should facilitate patient to achieve the spiritual growth. What are the spiritual growth? It means that they can feel more better and then can feel forgiveness or something that they feel more positively about their life. So this spiritual growth, sometimes they can enhance health status and well-being and the mindset of the patient that help them to cope with the illness. In some group of people, especially for the end of life group of clients or of people. The fourth one is the nurse should integrate spirituality into all steps of care. The next slide, I will talk about how in Thailand integrate the spirituality into the care from the wellness status to the illness status, right? And provide some support as they need. For example, in private hospital in Bangkok, right? Their clients almost from Muslim Arab countries, so they also provide a big masjid or for Muslim prayer in their hospital, and they provide a special unit for Muslim or for Japanese patient or for European patient. This is they integrate the cultural background or cultural belief in the provide and support during the nursing care. The last one is very important when we perform the spiritual nursing care. So we need to promote patient self-care to make them more valuable in their life, and they can cope with their illness or their suffering. And the valuing in their life, they may improve their spiritual growth as well. This is the concept of the spiritual dimension that I talked before. This is an example. So the spiritual dimension almost different from the ethnic background, differences by the religious belief, or it's may different even in the same family. So to explore the spiritual dimension, the nurse should assess the patient or clients individually and to make sure that what are our patients' spiritual dimension, that it means that what are the beliefs. So spirituality may not only religions, but it may be love, compassion, or peacefulness, or wisdom, or sometimes a sense of strength. This is the study from Franco Valencia. They explore some cosmovians ethnicity that they found that the spiritual dimension of this ethnicity is a lot of domains, right? Living place, dress, or music party. This is like a something that we haven't think before, right? A dress. Oh, dress is the spiritual dimension. So they are aware about the dress, like a Muslim, right? Spiritual of women Muslims. So this is hijab, right? When even they ill, they have to hospitalize, so they need to wear the hijab, right? Some hospital may not, they don't allow Muslim women to wear hijab during their illness. So this is sometimes our nursing practice may violate the spirituality of the patient, right? The spiritual need assessment tool. This is an example that may that normally used in many countries. We call the hope assessment tool, right? Hope is mean it's from the four alphabet, right? For example, the first one they ask about hope and organize the religion for personal, spiritual, and effective and effects on medical care in life issue. So you can ask this question, use this like easy question to ask your patient to explore, to assess the need of spiritual care from the patient. Another one is like a scale, right? This is the assessment form. This one is not suitable for the illness patient because it's have many questions, but it's good for research. So when we want to apply the assessment, so we have to choose that one is appropriate with our job or our practice. There are another studies that they explore the spiritual needs of the patient. This is the Muslim, I think if I understand is in Iran, right? For the Muslim. So what are the spiritual needs for Muslim patient in Iran? This is from the qualitative study, right? They provide the need is like the patient need to express opinion, right? How to express opinion. So we have to understand and to assess what are the needs of the patient, right? Such as the communication with the treatment group, carrying a religious symbol, paying attention to worship, some clinic, right? In Thailand, they provide the prayer room or เขาเรียกว่า Tayammum, right? Tayammum, the like the equipment for illness patient or for critical patient to perform the tayammum in the hospital, right? Compliant with prohibition. For example, like that I talked before, like keeping hijab, right? Because in Thailand, this is non-Muslim country, so sometimes our patient are not allowed to wear hijab in the like the unit or the ward, right? Non-mahram in some clinic, for example, in the midwifery care, right? They need their husband to come with themselves to know about the condition, or need their husband to attend the delivery, like during they born the baby, in the private hospital. So they allow this practice for the family, but in government's hospital, maybe this is not allowed. So this is like a spiritual conflict from the patient that oftenly occur in Thailand, right? Especially for the hospital outside the deep south of Thailand. Even in the deep south, some spiritual needs of the patient. So the system organization could not provide this care to them, right? Being protect. What nurse should be done, such as helping the patient to do religious ritual, for example, pray, and some in Ramadan, right? The doctor may adjust the prescription or their medicines about the DM, right? Diabetic mellitus patient, to adjust with the right fasting period. For example, this is in the southern part. They perform this care to the patient, right? Attending the patient bedside, giving hope and solace with the patient. This is, I think, Indonesian may understand this issue, because most of them are Muslim. So the need of spirituality, spiritual nursing care from the Muslim patient is is common for Indonesia, right? But in Thailand, because we are non-Muslim country, so in the practice, so we have to like encourage, or we have to inform many things to make the nurses who are not Muslim to understand the spiritual needs of the Muslim patient, right? So it's a challenge for us now, how patient or how our clients be protected or be served the need of spiritual care in especially the spiritual need that allied to the religious practice, right? Spiritual needs of the patient may not be only the religious dimension, but may also include the meaning and purpose of life. It may include the hope and faith, right? And it may mean the connection between people or between group of people, for example, for their families.
Prof,
And
10 more minutes.
yes, they need sometimes they need love and to be and belonging, right? This is the spiritual needs of the patient. How to apply in nursing practice, right? In Thailand, I think the spirituality is more aware by the nursing profession, right? We are trying to make our nurse to give more worldwide worldview, right? Large worldview, understand the life and illness in a specific of populations. So this picture, right? We know that some Indian people, right? They believe in some dead, right? And they use the death ritual at the river, right? The river in India. We have to understand how they can drink this water, even we saw that it may not clean enough, right? So this is we call that empathy and to deep listening from the spirituality from the heart of our clients, and this is make the nurse not to prejudice or not to judge them, right? This is can decrease the biasness from each of the patient, right? Many studies, right, explore the benefit of spiritual care, right? This is some study that show that practice of spiritual care or spiritual nursing care to the patient can enhance mental health, well-being, and spirituality of patient, right? Reduce stress and burnout, and enhance patient-nurse relationship, and improve coping mechanism and quality of life. Spiritual, when we want to practice the spiritual, right? What we should to consider. The first one is we have to look at the spiritual competency of the nurse, right? The nurse should have the awareness. The first one is awareness to understand the spirituality of our patient without condition or unconditionally, and then apply the appropriate strategy, appropriate approach to each of the different patient or different clients, right? We should provide a religious practice because most of spirituality correlated with the spiritual practice, religious practice, right? Sometimes we can be spiritual counselors and to connect some people or some community to help the patient to cope or to solve the problem during the illness or wellness grade or in some condition, right? It is good if the nurse can plan for the spiritual care before and use the standard of spirituality. But this is the challenge in nursing profession, right? A few standards of spiritual care. We have many standards, right? For example, standard to improve the bed sore, to prevention the bed sore, but the spiritual care standard is limited in many countries. In Thailand, we not only apply spiritual care only in the illness state, but spiritual care program for during wellness state is more common, right? For example, they practice, this is the service, right? Practice mindfulness program or meditation program or something like this. This is we apply the spiritual care, but in wellness stage. How about in the promoting situation, we apply the spiritual care to improve vaccine coverage in communities, as we know that some of Muslim, right, untrust with the vaccine, and they questions about the halal and haram. So we use this spiritual care in the mosque and to make the parents of the children understand in Islamic belief, in Islamic perspective about the immunization program. And this is an example for delivery room, right? This is like a we azan or iqamah after giving birth of the baby, right, in the delivery room. And how about spiritual care during end of life? This is a child that faced with the cancer, right? Cancer, and she can like can prepare herself to face the death. She know and she can face the death with peaceful. This is only 8 year children that she can understand the death, right? But this is not like not by chance, but it's she attends some program for preparing the death, right? And this is the like a mascot, right? These children, they also got the cancer and they may face the end of life. But once in her life, she want to make the butter bear. This is a mascot, very famous in Thailand. So the hospital invite this mascot to make her in the hospital, right? This is the spiritual of spiritual care, right? To make the children to be happy even in the end of their life. The last one is the doctor, right? She is the a medical professor in Chiang Mai University, right? He also have the cancer, lung cancer, but the end of life, what is his spiritual? So he want to do something. He want to like make the people to aware about the PM5, PM 2.5 that affect to his health and other people, right? So before he died, he launched the campaign, right, to combat with the PM 2.5 program, right? This is his spirituality that the nurse and the health professional help him to support this program. And nowadays he also died, right? In Thailand, this is we call the planning of dates, right? There are some program to make the not end of life, but normal people to understand date and how they can prepare the date and what kind of date that they want to face, what ritual they want to do to be done if they die or for something like this. This is program planning for date, right? In Thailand, even in the crisis, right? In the crisis, there are some spiritual need, especially in COVID pandemic. This study is very interesting that the nurse have the conflict in spirituality because there are so many like a regulation that not allow the patient to do in some ritual during their illness or during COVID pandemic,
Excuse me,
right?
Prof. One more minute.
Yeah. And how when this is the spirituality, in some spirituality that may affect negative effect to the health. So sometimes this is we need to negotiate and to how to transform the practice. For example, right? This if someone, right? If someone need to this medium, right? He got the diabetes, but he have to practice his spirituality every day, and then he need to drink the sweetness, sweet drink. So his blood pressure was very high and cannot control. So this kinds of spirituality that we have to negotiate in some background, right? In the challenge in implementing spirituality in nursing is that a lot of nurse lack of knowledge and training, right? Sometimes they have time constraint, and sometimes they fear of intruding on belief and personal bias or some of their belief themselves. In summary, right, spirituality is not beyond religion. It may be meaning, purpose of life, love, and compassion. Spiritual nursing is essential and benefits to quality of life, and it can apply in all states of health, not only in illness state, right? And through the lifespan. Spiritual nursing, the important is to enhance client spiritual growth. Yes, this is my summary of the presentation. Okay, thank you very much.
Thank you very much for a very informative presentation on spiritual holistic nursing. This talk emphasizes that holistic nursing involves caring for the whole person, not only physically but emotionally, socially, and spiritually. Which is in your part of Thailand, it is a majority the Muslim people. And also spirituality in this context goes beyond religion, encompassing meaning, purpose, connection, and also compassion. We learn about theoretical frameworks, spiritual assessment tools, and also practical benefits of integrating spiritual into nursing, including improve patient outcomes, reduce stress, and stronger nurse-patient relationship. Also highlighted applications such as supporting vaccine uptake and end-of-life planning. Despite the challenges like limited training and time constraints, spiritual care remains a vital component of holistic practice across the lifespan. Just for your information, Prof, we here in UNISA, we have the spiritual Muslim nursing care and also midwifery nursing care, Muslim nursing mercy, sorry, midwifery um Muslim care. So we have that already in our curriculum. So the student here learns about the things that already you explained in your presentation. So we ask the student to be trained in how to um, what is it, help the patient in doing wudu, taking wudu, and then also other things related with Islamic, especially in the life end of life treatment or also care. We the students also being taught how to deal with the situation. So alhamdulillah, that's what we do here. And then now we go to the next part of this session, which is question and answer. I can see there is one in the chat. It is from our student Alpha. The question is, how can nurses integrate spiritual care into holistic nursing practices to support patients' emotional, psychological, and spiritual well-being?
Yes, I think the spiritual, and sometimes we also have done, right? Have done already, but we haven't known that this is spiritual care. Mostly nurses have done, I think, but how to make it more systematically. So it means that nursing care plan is very important. When I read the nursing care plan and the nursing intervention in the medical record, right? Mostly they write or they wrote about the physical, emotional intervention, nursing intervention, but a few that write it about the spirituality, right? It's spiritual care in the nurse's note in the medical record. So it means it look like that the nurse have less practice about the spiritual care, but I think in normally they already have done, but improve. If want to improve in the writing, when we write, so we have some evidence and we have like a PDCA, right? The most important thing is that the nursing care plan should be clearly and should be added in daily practice, so we can upgrade the spiritual nursing care as a part of the physical or mental care, right? This it is good best if you can perform the standard of practice in the spiritual care and inform to your colleagues. So every patient, right, should be assessed or must be assessed for the spirituality when they're admitted in your ward or in your unit. Rahman, yes.
Yeah, okay. Please, Pak Rohman, your question.
Please unmute your microphone.
Please try again, Pak Rohman.
Okay.
Yeah, okay.
Okay. Thank you, Associate Professor Dr. Rohani, for your great presentation to us. So much many information to us about spiritual holistic nursing intervention. Maybe I just want to ask about how the implementation of spiritual holistic nursing apply to patient with mental health disorder, especially maybe schizophrenia or bipolar in Thailand. And for the implementation of the nursing intervention, should we elaborate the intervention with consideration of Thailand culture maybe? Because it's different Thailand culture and Indonesian culture. So that's the question. Thank you so much.
Okay. The first question is how we implement in psychiatric patient, right? In the spirituality of not spiritual care for psychiatric patient, sometimes we integrate with the cultural background or cultural competency. So in psychiatric patient, almost before they come to us with the psychiatric condition, the patient or their relatives may take them to the to perform the ritual activities, right? And they believe according to their spirituality. For example, take the patient to the Babo, religious leader, right? Muslim religious leader, right? We call Babo or Imam, right? This is spirituality, but in the psychiatric patient is sometimes it's more complex, right? When they use this interventions, our patient may have the less time to take the medicine, so that may increase the progress of the illness of the psychiatric patient. In this case, right, we perform the concurrently and do like we call the bilateral, do parallelly together, right? We allow them to perform the practice as they need, but sometimes we inform the imam or inform the imam that imam, you can use your way, but you have to inform them to come to us first, right? So we inform imam to we teach imam to know about the like a psychiatric doctor, and then ask imam to tell this information to the patient, and they can treat parallelly, even they believe. So this is like a concurrently, and it help the patient get more like a more health condition, good health, better health condition, or can control the psychiatric symptom. In some nursing practice at the unit, right, we allow them to use the like we call the religious because we have the psychotherapy, right? Another program is we call the religious therapy. Use the religious belief for treatment the patient. So we have the like a group psychiatric group support or intervention to know about the Islamic perspective or Buddhist, how to cope according to Islamic or Buddhist perspective. And this is help our patient a lot because there is the inner side. So this is the program, this is the standard program. In this case, they are especially in the drug addiction hospital, right? We use a lot about the religious program to the patients. Yes. What is your second question again, please?
Okay. For the second question is how to elaborate about nursing intervention based on spirituality and culture in Thailand. So because there's different in Indonesia and in Thailand, maybe the key point how the culture is implementing in spiritual based nursing intervention in Thailand.
Culture, you mean, right?
Yeah, culture.
Mostly we integrated, right? As I said that there are the object standard. I think nobody write the standard of spiritual care in spiritual nursing care. So this is like a integrated and individually practiced. Some nurses, sometimes they may not perform, right? They may not perform this practice, but the nurse who have the sensitive in this spirituality, so they practice. That's why I think it is good if the SOP or standard of practice in spiritual care have been done and informed and used as like a physical or another procedure, a standard of another procedure, and we can implement like routinely. So, for example, in cultural, we integrate in spiritual care. That is we can see in the end of life. I think it's more right. It's more we can figure a lot at end of life care. For example, we allow the patient relative to do some ritual at the end of life in the hospital. For example, if Muslim, right, we allow them to stay at the hospital and read the Quran for them, right? For Buddhists, so we invite the monks, right, to do some Buddhist ritual for the patient, or for Chinese, or for something like this. But this is not like a systematically approach, but this is individual approach. Yeah.
Yeah, thank you very much for the question and on the answer. Due to our limited of time, so we go to the next activity, which is handling the certificate for our honorary speaker, Dr. Rohani Jeharsae. The certificate will be given by our Dean, Ibu Ami Kamila. Please.
Okay, I'm
Yeah.
here. This is Miss Rainy.
Yeah, okay.
Okay. On behalf of Universitas Aisyiyah Bandung, it's my honor to present a certificate of appreciation to our distinguished speaker, Dr. Rohani Jeharsae, from Prince of Songkhla University. Thank you for insightful presentation on spiritual holistic in nursing. Thank you for being with us today, Dr. Rohani. This
Yes,
is
you're
the
welcome.
certificate.
You're welcome. Thank you very much.
Okay, thank you very much. And now I invite all of our honorable speakers to be there on their camera, turn on their camera so we can have a photo session. Yeah, thank you, Prof. Zamzaliza, and then we'll wait for Dr. Kirti. Yeah, okay. Should I'll count to 3. 1, 2, 3. Okay. Thank you very much again for very insightful talk today. I am signing out. Um, please receive my sincere apology for all of the inconvenience and then all of the um, lack of interest or anything related with the presentation that I am lack of. I will say Alhamdulillah, Alhamdulillah Rabbil Alamin, and Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam.
Thank you to Mrs. Raini Purnamaraya, SKMM EPID, for guiding the second panel session of this conference.
And to all the participants, please turn on your camera because we will take a picture together for today's international conference. Okay, for all the participants, please turn on your camera because we will take a picture together for today's international conference. Okay, for the first slide. 1, 2, 3, smile. The next slide. Please preparing your best smile. 1, 2, 3, smile. Okay, the next slide. 1, 2, 3. Okay. Okay, for the next slide. 1, 2, 3. Okay, for the next slide. 1, 2, 3, smile.
The next slide. 1, 2, 3, smile. For the next slide. 1, 2, 3, smile.
Okay, enough for the take a picture together for today's international conferences. And to all the participants, you can fill the links of absence we will share in the room chat.
Okay, wow, how wonderful material from our speakers in the second panel session.
All right, of course, Sister Rima. So we get so many knowledges from our material from today.
Okay, so are you still focused, guys, for the second quiz?
All right. Also, we have a second quiz for the second panel session. So get ready for you, everyone, for answering the question we will share on the quizzes.
For participants who haven't won first quiz, this is your chance to win in the second quizzes. The quiz link will be sent in the Zoom chat. Please click on it for joining the quiz and write real and your full name and prepare yourself for answer the quiz.
Okay, we will start the game after 50 participants of this game quiz. So make sure you joining of this quiz and get for the winner for the second quizzes. For all the participants, please write your real name and your full name. Don't forget to enter the passcode or you can capture the barcode on the screen. Okay, we will give you 2 minutes left before we start the room. Okay, 1, 2, 3, start. Okay, so let's see who wanna win for the second quizzes, right, Sister Rima?
Yes, of course.
Jellica leads the quizzes for now. Jellica still leads the quizzes for now.
Okay. Okay, we will give you time 2 minutes left for answering the question on the quiz. Okay, for this, the winner for this second quiz is goes to Okay, sorry for all the participants. Maybe we will get wrong from our device. All right, for the first winner from this second quizzes goes to Malaysia, and the second winner is Trisalwa, and the third winner is Putri Rudia. All right, congratulations to all the winners. So after all long the conference is international today, so we have a little appreciate for the best participants of today's international conference. So we will announce now. So the best participant of UB Inspire 2025 goes to David Muhammad Rizky. Congratulations for David Muhammad Rizky as the best participant of this international conference today. So also congratulations to all the winner from the first quizzes winner and the second quizzes winner. So you can contact the commit after this international conferences to get your gift.
And to all participants, please fill the link for evaluation this international conference. We will share in the room chat before you left the Zoom.
Ladies and gentlemen, we are in the end of the third UB Inspire 2025 Universitas Aisyiyah Bandung. Hopefully today's conference can bring knowledge, information, and also inspiration for us.
Thank you to our outstanding speakers and to all participants for your contribution and attention. Looking forward to seeing you at the oral presentation and poster exhibition on 14 August 2025. And the last for us, wassalamualaikum warahmatullahi wabarakatuh.